New confirmed cases, 377. New probable cases, 154. Active infections 7,314. Recovered cases, 87,337. Total tests performed as of today, 732,239. Total persons tested, 365,126, with 96,040 positive cases, 269,086 negative persons. We're currently reporting the RT-PCR positivity rate, since that measure is being used by CDC as well as CMS for nursing homes and long-term care facility reopening plans. That last 7-day number as of this morning is 16.7%. All of this data can be found on our COVID dashboard, which can be found at doh.sd.gov. As a reminder, data reported on the dashboard is considered provisional and is updated as additional information becomes available. Additionally, this will serve as our last press briefing call of 2020. We will resume these briefings on January 6, 2021. I will now turn it over to State Epidemiologist, Dr. Joshua Leahy.
Thank you, Daniel, and thanks for those updated numbers. Just a reminder for everyone that our dashboard does include the most up-to-date information, both on our case counts as well as our vaccine administration information. So the vaccine summary that I have for you is that the update today shows 8,398 total doses administered in South Dakota. This does mean that our total percentage of the population that has been vaccinated is 0.95%. And that may not sound like much, but we are leading the nation and are at the very top of that, both with North Dakota, South Dakota, and West Virginia. As far as the days ahead as we're going into the holiday season with Christmas on the way, I just want to take just a moment to remind folks to take precautions this holiday season in order to protect yourself and your family. You can find some of that information on how to appropriately have gatherings if you are having additional folks in the house or that you are traveling for the holidays by visiting covid.sd.gov. Click on the Public Health Information link, and then scroll to the bottom of the page, and there'll be holiday precautions and tips. With the COVID-19 cases, hospitalizations, and deaths increasing in many parts of the country, make sure you are actively considering, whether or not to take part in travel to see family. Celebrating virtually or with only those members within your household is an alternative. Make sure that if you are traveling, that you limit your exposure during travel, and some of those tips that I mentioned how to access earlier will be helpful. Also, making sure that you're assessing your risk based on the location that you're traveling to, the duration of time that you're spending with individuals, the number of people that you're spending time with, and the precautions that are in place do make a huge difference. So being very upfront and transparent if you are choosing to get together with others outside of your immediate household. Just also a reminder that you should not be attending any in-person holiday gathering if you are sick with COVID-19 or have symptoms of COVID-19. We're asking that those individuals stay isolated at home. If you have been exposed to someone with COVID-19 in the past 14 days, making sure that you're staying in quarantine and that you're monitoring your health. Or if you were tested or awaiting your COVID-19 viral test, to make sure that you're staying away from those holiday gatherings. And last bit here is just that you are also at increased, if you are at increased risk of severe illness due to COVID-19, you may want to rethink those holiday plans. So now I'll turn it over to Secretary of Health, Kim Elson-Reisen.
Thank you, Josh, for that update. Thanks, folks, for joining us today. I'd like to just recap a few items for you. Excuse me. Since our last call, the Moderna vaccine has reached South Dakota, and so the vaccines that we're seeing reported on the vaccination website and on the covid.sd.gov website include both that first bolus of Pfizer vaccine that we received last week, and now the Moderna vaccine. So we saw 14,600 doses of Moderna delivered to South Dakota vaccinators earlier this week, and we have plans in place to disperse that vaccine within the week. So I would really like to do a big shout out to our Phase 1 vaccinators. They are doing a tremendous job in the logistics of getting this vaccine to people in South Dakota. And we continue to work very closely with them, obviously, to monitor and track that distribution and administration. You can find more details about our vaccination plan on the website, as well as a list of the priority groups in Phase 1. I'm pleased to say that we'll have 3 phases of vaccine availability. Right now, we are in that very first phase, 1A, which includes over 19,000 healthcare providers. With the vaccine that we received last week, along with the vaccine that we're receiving this week, we anticipate being able to vaccinate the folks in that first 1A priority group by the end of the week. A couple of reminders about vaccine safety. Again, the U.S. vaccine development system is among the strictest in the world, and all of the vaccines that we're getting here in South Dakota do conform to those U.S. standards. We have not seen reports of serious adverse effects from any vaccine administration in this state, and we'll continue to monitor vaccine safety data daily and make that available as we have it. I do also want to mention an update on the testing front and just remind folks that we really encourage people to be tested, especially ahead of any holiday plans. Give yourself and the rest of your family peace of mind. We have the free saliva-based testing that is available to order through the website. That is testing that you can do at home, and the costs are covered for that. So, we've had over 732,000 tests conducted statewide since the beginning of this pandemic, but continuing to, diversify the testing that's available to South Dakotans across the state. I'll just also just reiterate on the holidays coming up that, it's easy to let your guard down. I know people really did what they could do over Thanksgiving, and we were very thankful to not see a post-holiday surge. Really do not want to see a post-Christmas surge. And so I know with cases going down that it's easy to kind of think that we can do the things that we want to do and be around other people, but really want people to be cautious with that. We really want to avoid that post-holiday spike. So do remember that the saliva-free at-home testing is available for individuals. So if people do travel, we would encourage them to be tested if they've been, possibly exposed to anybody with COVID. So with that, again, I would just like to say happy holidays to all of you. You've been very gracious, I think, in helping us get the word out and, using facts and helping people know how they can play their part in mitigating COVID in our state. And so thank you for that. We appreciate your help, and I'll say we'll thank you in advance for the help that you'll provide us in 2021.
Okay. Thank you, Madam Secretary and Dr. Clayton. At this time, we would like to open the floor for any questions. If you would please identify yourself, your outlet, and ask your question. Who would like to go?
Tom Hanson, Kelloland.
Go ahead, Tom.
Yep. Hey, it looks like numbers are trending in the right direction in South Dakota, surrounding states like North Dakota. As we get together for the holidays, could you guys address the effectiveness of wearing masks again for us?
So, Tom, this is Secretary Malcolm Risden. We do encourage people to wear masks if they're going to be in situations where they can't, separate from other people, especially in indoor settings. And so that's one mitigation strategy that's important, along with, again, maintaining that social distancing, staying away from other folks, good hand hygiene, and all of the other things that you'll find on our website. So masks do matter, and we ask people to, wear masks when they can't, especially when they can't exercise those other mitigation strategies.
Okay, next question, please.
This is Stephen Groves from the AP.
Go ahead, Stephen.
Yeah, kind of along those lines, I know there was concern about a post-Thanksgiving spike. I wonder if you could tell me kind of what you saw change in the state or in behavior with people during the Thanksgiving time period that you think led to there not being a post-Thanksgiving spike and the current decline that we're seeing.
So, Steve, I can start, and then Dr. Clayton will chime in. But I think people in South Dakota, they used the information that they had. They took responsibility, and they changed. A lot of people changed their plans from what they would traditionally do in terms of celebrating Thanksgiving, and made other choices. And for that, we're very grateful. I do think that individual behavior played a large role in not seeing that spike after Thanksgiving. And I know that's a hardship on families, and we're asking people to do it again on, for the Christmas and the upcoming holiday period. But, with maintaining those mitigation strategies, with vaccine on the horizon, we really do have a light at the end of this tunnel. We just need people to hang in there.
And this is Dr. Clayton. I think, one of the things, that may have been a participating or a factor in individual actions over the Thanksgiving holiday is just that, we were in the month of November where we were seeing those huge increases in cases with our peak around November 12th. And so I think there was an enhanced awareness of the implications if people did travel, whether or not they were feeling fine. We know that asymptomatic transmission is possible with COVID-19, and we're asking people to, even though we're seeing decreasing case numbers since that our peak in November, we're asking people to remain vigilant and apply that same thinking when they're talking about potentially getting together with family over the Christmas holiday, so that we do not see that rebound in cases in the week or 2 weeks after Christmas.
Okay. Next question, please.
Troy Timmerman, Dakota News.
I heard Abby, and then we'll go to Troy.
Thanks. So you mentioned something about the free at-home tests and, encouraging people to get tested. Is testing still an important part of the mitigation process? And have you been sort of trying to test people the same amount as before the vaccine came out, or are you focusing more of your efforts on vaccination?
Yeah, and what I would say is, while we do have a strong focus on making sure that individuals who are in the appropriate priority groups are getting access to vaccine, that we're getting those shots that we are receiving from the federal government to South Dakotans as quickly as possible with our healthcare partners. That we're also having a strong focus on making sure that individuals have access to testing. As we mentioned before, the vaccine is one tool in the whole COVID-19 response. And so we want to make sure that individuals who are showing symptoms are able to receive a test. That individuals who are identified as close contacts to persons who have tested positive for COVID-19 can also get tested. We know that that's really going to be some of the most beneficial ways of slowing the spread of COVID-19 within the state of South Dakota.
Okay. I believe our next question is from Troy.
Yeah, Troy Timmerman, Dakota News Now. Yeah, the question is, has the blizzard today caused any disruptions in the delivery of the vaccine to around the state?
Troy, we don't have any reports that the weather is inhibiting any of the planned vaccination efforts.
Okay.
Thank you.
You're welcome.
Next question, please.
This is Jonathan with the Argus Leader.
I heard Jeremy. And
Yes,
then we'll go-
Jeremy Peterberg.
Okay, go ahead, Jeremy.
Yeah, my question is about if we have any idea about upcoming shipments of either the Pfizer or the Moderna vaccine, whether we have any estimate of numbers and delivery times for those?
Sure, thank you for that. We expect about 5,100 doses of Moderna to come in next week. We also, I don't have the number, we'll clarify that for you after the call. We do have the number, there we go, thank you. We also have doses that will be going out to our long-term care facilities. That's through the federal partnership where nursing homes and assisted living centers across the state and really across the nation had the ability to choose who they wanted to have as their vaccinating partner. And so we have 5,850 doses of 4,875 doses of the Pfizer vaccine going out for that. In addition, we have an extra 975 doses of Pfizer that will be for the non-nursing home population.
I believe our next question was from the August Leader.
Yeah, hi, this is Jonathan. I'm curious for your insight on why you think cases have dropped so dramatically in the last 3 weeks or so, and to what degree the susceptibility pool has decreased. That we do have one of the highest sort of case rates in the nation. I'm kind of curious where you think we are in actual infection rates.
Yeah, I think that there obviously is going to be a little bit of a difference when we're talking about the case rate of individuals who are actually identified with COVID-19 infection versus those who are infected and either are not tested or have asymptomatic infection that is not identified. We know that we have been one of the states that had increasing transmission earlier on, as many of the Midwestern states have. We have seen decreasing cases in many of those same Midwestern states as other parts of the country have started to see their increases. And so, I know that some of the discussion around what leads to some of those increases relates to changes in weather to bring people together. But as far as fully knowing kind of what the impact is overall for susceptible individuals and that continuation of illness, I don't have any insight at this point into why we've seen those cases decrease for us, but we do hope that they do continue to decrease. Again, I think this does come back to some of the practices that we've talked about in terms of needing to take precautions, that individuals do more of that when we do see increasing case counts, and again, do need to remain vigilant, even with our decreased case counts, especially as the Christmas and New Year holidays are oftentimes leading to a lot more get-togethers, both with family and with friends.
Okay. Can we please have the next question? Can we have the next question, please?
Seth Tupper, SDPB.
I heard SDPB.
Yeah, Seth Tupper, SDPB. I was just wondering if you could summarize first again, who are the people that have been vaccinated so far? Again, who are the group that you're finishing up this week, and who's the next batch of people to be vaccinated, and how many people are in that group? If you could just kind of give us that overall summary.
Sure. Finishing this week is 1A, and there's an infographic on the DOH website that we would point you to. It's kind of a nice way of visualizing kind of who are in the different groups. And so Included in the group that we anticipate being done here within the next week are those frontline healthcare workers that are directly serving people with COVID in those hospital and long-term care settings. Okay, so that includes staff at nursing homes, it includes staff in hospital-type settings, including ICU, COVID units, and general acute care units and emergency departments. So that's about 19,000 individuals, and we anticipate getting through that group here in the next week. Long-term care residents then are the very next group. That group will be, we've had some start on that group, and we will really be seeing a lot of activity of vaccinating that group starting next week so that we can protect those vulnerable adults. Depending, there's what we anticipate seeing as we work through the vaccination priorities here is some fluidity and some overlap between the groups. And the reason for that is that there are some very particular storage and handling requirements associated with these vaccines, especially the Pfizer vaccine. And so our number one priority is that we do not see vaccine go to waste, and so we anticipate getting into that group of 1C starting next week, which includes other healthcare workers and certain emergency responders. And so we anticipate starting next week to start to get into those groups in certain geographic areas, and then from there the priority will likely be that 1C population.
Okay. Next question, please.
This is Stephen Gross from AP again, if there's no one else.
Go ahead, Stephen.
Yeah, I just wanted to follow up on a comment that Dr. Clayton made, kind of discussing the decision that a lot of people made to change their plans during Thanksgiving, especially when we saw exponential growth during November. I'm wondering if, given the current situation with the decline, is there concern that there's not as much public awareness of the potential for the virus to spread during December holidays and Christmas and New Year's, and that we could see a post-holiday spike in January?
Stephen, this is Secretary Malcolm Rice, and I guess I would just make a comment that I don't think it's a lack of public awareness. I think it's really just fatigue from people needing to follow mitigation strategies for months and months and months. And so I think the potential is that with our cases going down, which is great news, and with hospitalizations, going down, which again is great news, that the opportunities is for people to think that it's okay to go back to, pre-pandemic behavior, and that's what, we want to make sure people stay with what they need to do, through this next holiday period, so that we don't see a post-Christmas spike.
And what I will add is that that I did mention that people have assessed their risk differently. Looking at the cases that we had over the summer versus when we were seeing between 30 and 80 cases any given day of the week over the summer versus seeing our peak of over 2,000 cases on that November 12th date. There's a difference in individuals' perceived risk, and so I think that we do see that eventually that perceived risk does tend to dwindle with time, but I'm hoping that we still have enough of that coming off of that peak in November that individuals will still take precautions through the holidays in December here, so that we don't see that post-holiday spike. But we also know that there's a lot. There's a lot more time in there. There's a lot more nostalgia that goes around getting together over the Christmas holiday, or spending time with friends and family during the New Year's. That it's also going to be hard to make some of those changes. And so, I fully recognize the difficulty experiencing it myself with my family and choosing not to visit any relatives over the holidays coming up. But it also offers us opportunity to really take and make our new traditions. So.
We have time for one more question. Can I please have the last question? Hearing no questions, we would like to thank you for participating in today's conference call.